Y'all, this is my ninth shift in a row. And I figured that, let me take y'all in on a little mini vlog on a day of the life of a LPN working on a rehab unit. And I think it could be pretty interesting. See, I can't show y'all everything, but I can show y'all some things and how I go about organizing my day. So let's go. Now, normally I get to work around 10 minutes early so I can do a quick round on my patients before I round with the nurse. This is probably one of my biggest pet peeves, is not having a vital machine that is charged and ready to go. But honestly, that happens pretty much every day. One of the things I like to do is to make sure the nurses that's coming on after me is good. Make sure their vital machine is fully charged, and make sure it's not unorganized like this. You see how it's stuff everywhere. That's how I normally come in to the vital machine looking, and I don't like that. But what can you do? You know what I'm saying? It's multiple nurses that work on these carts every day, so there's no sense in making a big deal about it. See, this is better, and depending on if you know what kind of patients you have, you got the smaller cups right here, then you got your bigger cups down here. I keep my wipes right here just when I gotta wipe stuff down. Pulse ox is right here, and then I got my thermometer right here. So I just like to keep it organized a little bit so you're not walking into just anything. That wasn't supposed to happen. But I just like to keep it organized so you're not walking into just anything. And normally when I charge mine, I usually turn it all the way off so we can charge quicker, because these things take forever to charge. Now, once I do my rounds, I will meet with the nurse I'm relieving, and go over what happened during the day with the nurse and make sure everything is everything. We talk about if any falls happen, if anybody got sent to the hospital, if anybody's on any precautions. And normally with rehab, you're dealing with fewer patients, but 9 times out of 10, they're more, I would say, acute. You're dealing with people with falls and fractures and, here for weakness and things like that. So these patients are more acute than your patients who are on long-term care. So I come in, I do my checks first, and then I will go around with the nurse. Now, once the nurse and I are done rounding, and I get report and everything like that, I like to check the carts, make sure everything is all the stuff I need is in there. For your typical nursing home, long-term care, or rehab, you're gonna have your things like your glucometers, your OTC meds, which are over-the-counter meds. You're gonna make sure that you have saline syringes. If you have a patient that's on IV medication, you want to make sure you're flushing their medication and all that kind of stuff. You just want to have that stuff in your cart and make sure that you have things ready to go. Now these are all over-the-counter medication. I keep all my over-the-counter medications in here. It's just easier that way. And I used to, every night, what I used to do, I don't do anymore, I used to arrange my medications I will have like my pain meds here, my medications with like my stool softeners, my Senna, and all that in one spot. I have my vitamins in another spot. I would do that, but every single day when I would come to work, it would always be rearranged. So I just stopped doing it. And 9 times out of 10, this cart is not the typical cart, though. This cart is actually pretty small versus the carts that we usually have. But only thing that I do now is just when I get in, I just make sure all the medications are face up. So if I'm in a med pass and I'm not gonna say rushing, but if I'm really trying to keep up on my time, I have them all faced up, so that way I ain't gotta be scrolling trying to figure out which one is which. And then usually what I'll do is pull out the medications that I know I typically need. Like mostly everybody gets acetaminophen. Mostly everybody gets magnesium. Mostly everybody gets, if I'm a night nurse, so mostly everybody gets melatonin, a vitamin, stool softeners. I'll pull these meds out and I'll push them to the back. I'll push them to the back like that, just so I have them. And then when I start, doing my med pass, I'll pull my cups out and I'll just keep it pushing. You feel me? Another thing I do is I make sure all my medications are currently dated. You got a 30-day range with most meds, so you want to make sure that your meds are dated. I'm gonna put dates on these 3 right here, because the state, they look in for that, they check for that. Now this is my diabetic cart, the diabetic part of my cart where I keep my lancets, my syringes. Usually I keep them in here. I gotta refill it, but I'm just showing y'all. I can't show y'all really the other parts, but because it got people's names on it. But this is where I usually keep that stuff. On the left, I'll keep my eye drop medication over there. Let me see. Let me cover some things up so I can show you what that looks like. So I'll keep my eye drop meds over here, and that's how we'll do that. My insulin, my glucometer, all that stuff. You just want to make sure you're organized, and I'll do that. Now, if I'm missing an over-the-counter med from the cart, I'll go to the med room and see if we have it. If we don't, I'll let the person who orders these medications know that we missing a med, and I check that, and then I'll just go from there. Now, I have been getting a lot of requests to document what it's really like being a night shift nurse, and like I said, there's only so much that I could show you, but I mean, it's a shift to where it can go down if need be. You dig what I'm saying? Yeah, it's quieter. You're not dealing with families, but in my experience, more people tend to pass away at night. Some patients suffer from sundowners. Some patients, they stay up all night. Some people stay up all day, or they go to sleep all day and they stay up all night. So I don't want people to think that just because it is night shift, that it's any less, that it's just you're gonna sit around and like not do nothing. It don't work like that. It don't work like that at all. And what a lot of nurses will do is that they'll pass a lot of the day shift stuff onto the night nurse, because they think that, well, night shift nurses don't do anything, but that's not the case. It's really not. But I truly believe one of the most important things as a night shift nurse working in rehab is that documentation, keeping up with monitoring patients' vitals, especially if you got like diabetics, because diabetics, the brittle ones, you got to be on that. Those patients usually tend to start off high, because they just begin done eating dinner. You give them their insulin and then they go real low. So you just have to be careful. There are things that you have to watch out for on night shift, and I would not, don't sleep on the night shift, literally and figuratively. It's not to be played with. A lot of stuff can go down on night shift. I once had a patient who was sundowning in the rehab, and they was admitted to rehab for like a broken foot, but they were a vet. They were a former Army veteran and everything like that. And when the sun went down, it went off. You dig what I'm saying? So you have to learn how to manage situations like that. You have to learn how to stay calm during situations like that. That's why it's so important to do your rounds and get a background on patients. Look at that hospital paperwork when they first get admitted. If you're dealing with a patient you don't know, go back and look at that hospital paperwork, because usually it'll give you a good idea of the patient's history, because a lot of nurse reports suck, and you just got to do your due diligence. Now, once I finish checking my notes and any progress notes or follow up on any doctor's orders or anything like that, or any pending orders, or checking the home board, making sure anybody, to see if anybody has any appointments for the morning or anything like that. Once that's done, then I'll start my med pass. Now, usually when I come in early and I get a report from the nurse and look at my home board, that should take me about 30 minutes maximum. The report should not take that long. Looking through that stuff should not take that long, unless it's just something that's going wrong or something could happen. Things happen sometimes when you come in on a shift and take a car. Colds can happen out of nowhere, but normally on a normal day, that should not take any longer than about 30 minutes. And once that's done, like I said, I'll start my med pass. But y'all know I have to clean my cart first. I always clean my cart first. It's flu season. People running around with that ooey. So I clean my cart and then I start my med pass. So when I do my med pass, I normally start at the person who's the most critical on my roster sheet to the least, who's the least critical. And what is that called? Prioritization. Now, everybody has their way of doing their med pass. That's just mine. That's how I do mine. And because people who are the most critical, you tend to want to get them out the way early, because 9 times out of 10, they're probably in pain, especially on rehab, because you get a lot of fractures, a lot of broken bones, a lot of people who are just suffering from a lot of pain. So you want to get those people out the way. And if one of your patients, if they have pain medication scheduled, just give it to them. Give it to them, especially if it's scheduled. Now, if it's PRN, obviously you got to wait. But yeah, just make sure you get that out the way first, in my opinion. In my opinion, how you do yours is how you do yours, as long as you're safe. But I like to get that stuff done quickly. And I like to get my IVs. Like, if I got a lot of IVs, the most I'll probably have is like 2 to 3 at the most. I like to get those done ASAP. Because normally when you pass some medications, you get an hour before and an hour after, before you're considered late, or before you're considered out of the time window of passing medication. So I typically like to get those out the way early. Once I'm finished with my med pass, I'll go over to the treatment cart. I'm not going to show y'all the treatment cart because the treatment cart is a mess. The treatment cart is a mess. But I go over to the treatment cart and first I'll see if I have any treatments to do. Normally on nights in rehab, we don't have too many treatments, but if I see like a treatment is saturated, or if I see, and now for people who might be wondering, what's a treatment? A treatment is like a wound dressing, or cleaning the wound and leaving it open to air or something like that. If I see that it needs to be done, then I'll do it. But normally the wound nurse in the daytime does them. And but like I said, if it needs to be done, I'll just do it and knock it out. And after that, you do your rounds every 2 hours. You want to make sure you testing your glucometers. But that's pretty much it, man. On a normal night, rehab is usually pretty smooth, depending on how many you get, depending on if y'all have admissions. Tonight we didn't have any admissions, but yesterday we had 4. So it just depends. And it also depends on what kind of team you got around you. If you got strong nurses and if you got strong CNAs. Now, fortunately, I have some strong CNAs that work on rehab. So that's always good. And that's pretty much it, man. The day in the life of an LPN working on a rehab unit. Now, again, it's been a pretty calm night. Everything is done. I'm on lunch right now, so that's why I'm showing y'all what I'm showing y'all, during my lunch break. And that's pretty much it. Like I said, I used to want to just stay in long term, but since I've been working contingent, they've always kept me on the rehab side. So, and the unit manager on the rehab side likes me, so she wants me to stay over here. And I've grown to like it. It's, you see different patients, they admit and then they discharge, admit and they discharge, and that's usually how it go over here in rehab. So it's a lot more to do. Patients tend to be a little bit more, like I said, acute. They tend to be a little bit more needier. You know, when I say needy, I mean like they need their stuff. You know what I'm saying? Not somebody just looking for attention, because, but they really do need their stuff. And, you know, that's what we're here for. So anyway, ladies and gentlemen, my name is CJ, aka the High Value Nurse, checking in once again. Yeah, let me know how y'all routine is, and I'm gonna holler at y'all in a minute. Peace. I made $110,000 my very first year as a licensed practical nurse with less than 1 year of education. My name is CJ Kyles, aka the High Value Nurse, and in my brand new ebook, The Ultimate LPN Mindset, I give nurses, seniors, and healthcare workers alike the tips and the tricks that I use to shape my mind into what I needed it to be to get the money all up in these nursing homes and in these medical facilities so they can get the paper they deserve. And you can go get it at thehighvaluenurse.com.